Hi, this is Brass Check, and today we have a
Hi.
very special guest from the UK, Dr. Kevin Corbett, PhD. He has written a very important article, and he also has a unique and important background for the matter at hand. And of course, the matter at hand today is COVID, and how, most important, how COVID is being responded to by our
hmm
various medical systems. And Kevin's expert, of course, in what's going on in the UK, and we're going to get into that because it's a predictor of what might be happening in other countries. Kevin,
hmm
thank you for joining us.
Hi, Ken. It's very nice of you to invite me, and I've seen your channel a couple of times, so it's very interesting, and I'm very honoured to be invited onto your channel. Thank you.
Well, we're equally honored to have you share your experiences with us. So, Kevin, your professional background is as a nurse.
Yes, I qualified in the mid-1980s as a registered nurse, and in the United Kingdom, registered nurses, our registration is slightly different to the United States. It qualifies us in a different way. We don't generally work in psychiatry as registered nurses. We have to have a separate qualification to do that. So we're what was called general nurses. We look after physical and mental health as well, but we're not qualified as mental health specialists. I went to work initially in medicine surgery and had some experience in intensive care and high dependency in coronary care, and then went to work within one of the first HIV AIDS wards in the United Kingdom that was opened by Princess Diana in 1987. And I had a clinical career within HIV and AIDS. I was a staff nurse, charge nurse, and ended up becoming a clinical nurse specialist and a lecturer in HIV AIDS nursing and infectious diseases. And then I had the usual senior lecturer experience in higher education in universities within the United Kingdom as a senior lecturer in what we call adult nursing, general nursing, and experience in research, training, education, quite broad areas really, and also within public health. So my background's very broad as well as specific. And my PhD was in medical sociology, and I looked at people's experiences of testing for HIV and AIDS.
Oh.
So I looked at people's experiences of the ELISA and Western blot tests, the PCR tests, and the T4 cell count tests. So when the COVID issue emerged quite recently, it was like my PhD had come into a new era, as it were, because I could interpret what we were being told in relation to the RT-PCR tests as being false and inaccurate information from the government. And then, of course, I had all the links with the HIV/AIDS dissidents from the 1990s and 2000s, David Crowe, Peter Duesberg, Celia Farber, all the people that had been involved in the critique of that science seemed to me to be very well versed to help lead some sort of critique of the COVID science, if that makes sense.
Absolutely, we've been making an effort to educate our viewers about the AIDS. I just call it the AIDS scam.
Yeah.
And it's. I often say that if that scam, for lack of a better word, had been exposed thoroughly, we probably wouldn't have the COVID scam that we have today, and that the patterns of abuse that were used during the AIDS scam are almost identical. It's a different disease, but an absolutely similar playbook.
Yes. I always see this, the metaphor I use, if that's the right word, Ken, is a cinematic one. The HIV/AIDS experience was like the trailer for the main feature. The main feature film being COVID-19 and SARS-CoV-2, which we are in now. So the issue about HIV/AIDS was it affected very different population groups, very specific groups. And those were the at-risk groups. And now everybody is with COVID and SARS-CoV-2, the at-risk group. We're all told we're at risk from this. And so we're in the situation now, the general public's in the situation now, that HIV/AIDS patients were in the 1980s and 1990s. Except now it's a much more widespread experience. People are being targeted. We've got specific targets now in this country where the government's focusing on specific communities to lock down. And you may have heard this in the media. We've got lockdowns happening now in Leicester City in the middle of England. We're going to have possibly lockdowns in other cities like Bradford, Kirklees and Sheffield, where the government is focusing, a bit like Victoria in Australia, where they're focusing on specific communities to target for testing and for lockdown. But, I mean, does that explain my background enough for viewers?
Oh, absolutely. So in addition to, the practical hands-on work with patients,
yes,
and having actually experienced the AIDS crisis, because we're not denying that there were people who were gravely ill.
Oh, yes, hugely, yes.
Yeah, there's no question about that. The question is, what was the cause and what was the proper treatment? Yeah.
And with the HIV/AIDS, you had different different generations of testing, different generations of technology testing people. You also had different waves, different generations of people affected. The first groups affected, groups of people affected had multiple health challenges. That, this denialist discourse is a very dangerous one, I think, because you can't deny statistics and figures. As you say, it's what causes them that we have to look at and analyze. What's the cause of it?
And one of the confusions around AIDS was that they kept expanding the number of diseases that would be considered AIDS. It originally started as two somewhat different diseases. And I think by the time they were done, any one of 29 or more diseases suddenly became AIDS.
Yes. Well, you're seeing a similar thing with COVID as well, because you're seeing the expansion of the symptoms, the olfactory symptoms, the people are talking about losing their sense of smell and some auditory and maybe other sensate disturbances. So the similar drives behind the COVID symptoms to try and expand it even further. But the COVID symptoms are incredibly generic and quite expansive already. So you can code anything as COVID, like a headache, sore throat, a cough, a temperature, feeling hot. They're all presumptive COVID diagnoses. If you present at primary care or, as you call it, emergency room facilities, you'll be coded as a presumptive COVID case if you present with any of those symptoms, and irrespective of any laboratory work. And I think that's the major issue. One of the major issues I saw with the British National Health Service is this, since Christmas, there was this, certainly in London, where I live, which is the biggest city in the United Kingdom, there was this almost total closure of primary care and general practice in London, where you could not get in to see a GP. And the only way that you could get access to any medical advice through the National Health Service was through a telephone system called 111, which is different to the 999 service. I can't remember what you call that in America, the 999 service, you call it?
Yeah, 911.
911, we call it 999. But the 111 service is a telephone triage, basically. And they redirected everything, re-stratified that service in February and March along the lines of respiratory, non-respiratory symptoms. So they were interviewing you online, on the telephone or online for any suspicion of respiratory symptoms, and you were immediately fast-tracked as a COVID case, presumptive COVID case, if you told them that you had a temperature or you had a cough. All these generic symptoms that could be hundreds of different things were presumed to indicate COVID, which, part of my experience was as a nurse practitioner, And as you know, nurse practitioners are involved in diagnosing patients. And really the differential diagnosis since Christmas in this country has been skewed towards COVID presumptive diagnosis, which is non-scientific. It's, I think, a pernicious deviation of medical practice. Pernicious and evil. It's an awful word to use. I can't really use another word to describe it because it's so unscientific. It's a form of viral hygiene, really, that's very reminiscent of the racial hygiene that was prevalent in 1930s Germany. And that was part of the reason why I wrote this article called The COVID Nazification of the National Health Service, because of the direct parallels to the abuses of medical power and practice that we saw in Germany in the 1930s, which are in the history books. There's very few people around, if any now, that can remember those days. And so it does deserve some analysis, this, because what I saw in terms of, well, what I heard from colleagues was, lots of my colleagues were contacting me, very unhappy to stand out from the health service and say it was wrong. They were telling me what was happening within the service was really a bastardization of medical practice, a skewed version based on this notion of COVID, SARS-CoV-2, this total push towards viral hygiene that we're seeing now. It's becoming quite embedded. So anybody presenting at an emergency room was being coded as COVID based on no scientific evidence, just presumption. And of course, that went down the line. And so consequently, these very perfunctory studies that were done about aerosol transmission were used to push the doctors and nurses towards closed circuit management of these patients. And by that, I mean intubation, tracheal intubation, and mechanical ventilation. And of course, what you're so good about in North America is people standing up and saying this is wrong. You've got a much better history of this than we have. And very few people here have been able to stand out in the same way as the doctors in New York, that very young doctor called Kyle, and those wonderful nurses that have made those videos in the United States, and, really, for any registered professional, healthcare professional, and I'm retired now, so I'm not technically a registered nurse anymore, but the listening to those accounts and knowing what's been happening is actually a destruction of our spirit as healthcare professionals, because you can see the abuse, you can see the protocol-driven care based on these notions of viral hygiene and fear, contagion fear, really, this fear of transmission, which was really very, this is what reminded me of the 1930s Germany, because Hitler's Nazi Germany released this contagion fear within society. The Jews were the target initially, not just the Jews, but other individuals, people with learning disabilities, people who are incapacitated, gypsies, the Roma, homosexuals, the whole sets of groups within society that this was trialed on initially, this contagion fear. And this in Germany, then it was about the gene pool. It was contamination of the gene pool.
Right.
These groups seem to be contaminating the Volk, the national gene pool. Whereas now the parallel is this viral hygiene. We've got this notion of a contagion that's out there. To use that X-Files term, it's out there in society, and the government in this country has told the whole of the nation, any of you can have it and any of you can transmit it. That's the propaganda message, Ken, that was put on every poster on every street in this country.
Yes.
Anyone can have it, anybody can transmit it. So it made everybody a risk to everybody else.
Yes.
Overnight, very similar to the power that the Nazis had in Nazi Germany. And that, unfortunately, that a viral hygiene contagion fear went straight through the population, irrespective of training. So you have doctors and nurses in healthcare facilities totally guided by this propaganda. So they get somebody coming into an ER department in London who's got a temperature, who's got a pyrexia, that may has a cough, or instead of thinking, oh, this could be flu, this could be a cold, this could be something else to do with the condition they already have. Oh, this is COVID. Immediately, COVID case, intubation, elective ventilation. And I had colleagues phoning me in March and April. You know, I was really doing a little bit of what we call clinical supervision in a way, which all healthcare professionals do to each other. We guide each other. We help each other arrive at, you know, some sort of order to the symptoms and things. And a colleague of mine was an ER physician, a senior physician, called me one night and he said, I'm really worried about the false positive rate here. I've intubated 4 people tonight. And I'm not sure why I've done that, except the protocol. I'm driven by the protocol.
Wow.
I'm driven by peer colleagues that are frightened, that are guided by this protocol. And if I didn't intubate and ventilate them, you know, they wouldn't be happy. And so this whole scenario is being set up where people's behavior is being guided by the protocol, but also the fear that's been released amongst your colleagues, you know? And I said to my colleague, let's call him John for the sake of confidentiality, well, what are the x-rays like? You know, why did you go quickly to ventilation, intubation? Well, bilateral whiteout on the x-rays, we had a look, I had a look at these, and, you know, very often no pre-existing conditions. And, you know, what was their oxygen saturation like? They weren't that bad, you know, but because they had a cough, they had a temperature, they had some of these COVID symptoms, they were being driven towards ventilation. And unfortunately, you know, to me and to my colleague, he said, you know, yes, it could be flu. Could have been flu that I've intubated. On one end of the differential,
sure,
could have been flu. So, you know, I said, well, you need to get right up there to ICU and check out, you know, and that's too late because the patient's already in the system. They're transferred over to another unit, intensive care unit, and it's for them to manage. So this was the pathway, as we call it. I don't know what you call them in America, but we have these patient pathways. They're protocol driven. Now, the interesting thing about those protocols, Ken, is I looked at the protocols from several hospitals, which I probably shouldn't have got, but I got them surreptitiously from colleagues. And a lot of these were developed, you know, from the agency we have here in this country called National Institute for Health and Clinical Excellence. We have this, I suppose it's something like FDA you have these overarching agencies as well, don't you? But NICE has this, it has this image in this country of a rationing agency because it was created by the Blair government to rationalize the pharmaceutical industry, to produce evidence. NICE would produce evidence around what's most effective for the NHS to invest in. So it's about use of public resources. You know, it's just, you know, the National Health Service, people would not disagree with this. I'm going to say this. It is a socialist-driven health service. It's come out of social welfare principles after the Second World War. We had a socialist government in 1945 that set up the NHS. So it does have a socialist mantra to it. It's a sacred cow within British culture. You know, I'm trying to think of American sacred cows.
Maybe Social Security.
Social Security, it's something that's uncontestable within the culture in this country, uncontestably good. You know, it's something that's uncontestably good. So it's like saying Jesus Christ was a good guy, you know?
Right, right.
And you know, very few people are going to stand up and say, well, actually, he was pretty evil, you know? Right. So very few people are going to say the National Health Service is an evil thing. But actually, in the last 20 years, Ken, in this country, if you look at the evidence, the National Health Service has been implicated in massive inquiries There's been massive inquiries. We had a GP in Manchester in the early 2000s who killed well over 500 patients. We had Mid Staffordshire Hospital in about 10, 12 years ago that killed hundreds of patients through neglect. We have a continuing inquiry now into the Gosport Hospital in Hampshire, which over 20 years has killed hundreds and hundreds of patients through malpractice. So when you look at the evidence, this mantra of the NHS does become a little bit tarnished, but still, majority of people would say, hand on their heart, they'd rather have that than an American-style system where you pay at the point of delivery. So coming back to my colleague who phoned me that night in an ER department in London and was thinking he's intubating flu, this experience of the deviation of the differential diagnosis, I've experienced this with lots of colleagues in lots of ER departments in London, and it's been pretty standard since the end of February, beginning of March. COVID has been the presumptive diagnosis all the time. And you go in now and, all the stuff are in masks and PPE. Physical examination is becoming a thing of the past.
Wow.
Physical examination where you are examined, your chest is examined with the stethoscope, is going to become a thing of the past, I feel. And people are going to be scanned. They are being scanned. They're having CT scans and X-rays. Everything is going to be at distance, And if you look at the nursing literature now, I was looking at a paper the other day from one of the Hong Kong universities, that the big push is for telenursing.
Yes.
What we call telenursing, like telemedicine.
Yes.
Low touch or non-touch is the guiding paradigm because of this notion, this contagion fear that's been released. So this is happening widespread through society, but the issue in the NHS is that since February, well, even before, you've had this tiering of the service into respiratory symptoms one side and non-respiratory the other. And that's a very subtle stratification. It is a command and control that's gone right through the ether of the NHS. It's gone right through the substance of the National Health Service, the medicine service, the 111, the telephone service, the general practitioner service won't see you if you've got any symptoms. Everything's being done at distance, right? And what they did in January, February is they cleared hospital wards in the United Kingdom. They cleared psychiatric units. They cleared general medical wards to prepare for the cases, right? And the hospitals went into shutdown, so the public were disbarred. You couldn't visit people in hospital. You weren't allowed. And therefore, the level of scrutiny within the hospital service, the public scrutiny, went down, has gone down. And we had the statute, the British law was changed. There was a new act of parliament that came in called the Coronavirus Act.
Really?
Came in, yes, in March. It wasn't voted by any of the parties. It was waved through by an all-party agreement on a Friday afternoon. And this is like the Enablement Act in Germany that gave Hitler's regime huge power over the country. The Coronavirus Act allows all sorts of things now. You should really read it. It's an incredible act of parliament. At the moment, if a public health official feels that or suspects you to be at risk of exposure, you can be asked to give a sample. You can be asked to be tested. If you refuse, you can be taken, and it can be done by force. So we have this situation now in United Kingdom where it's basically, and I don't like to say this, but it is a form of martial law, because public health, the viral hygiene concept, the contagion fear, has infected the legislation. And with the Coronavirus Act, which is being extended every week, there's a new clause added to it. There's new powers given to the police. We cannot gather in groups of 6 or more.
Still,
it's illegal. Yes, it's illegal.
In the whole country?
In the whole country. And 2 households only can gather together as long as they're not 6 or more. So all the stuff you've seen on the media about Black Lives Matter in London, running up and down Whitehall, thousands of them shouting, all in black uniforms and black power signs and stuff, that was all allowed by the police. The police allowed that, but it was all illegal. And I was on Whitehall one of the Saturdays when that happened, and I asked one of the police why they're not arresting people. And he said, look at the number of police compared to the demonstrators. Mm-hmm. So they're getting away with the Coronavirus Act because people really don't understand the implications of it. They've not seen anything. People believe in the virus. People are going along with the Nazification through the culture. You've got to walk into a supermarket in a certain way. When I go to church on Sunday, I've got to go down the aisle in a certain order and come out of the church in a certain order. I've got to wash my hands 3 times or something. You know, this command and control that's gone through the whole of the culture so quickly is that word that I can never pronounce, Ken, the German word.
Gleichschaltung.
Gleichschaltung, which means same order, doesn't it? It means command and control. It was, it was used in this book by, I think, Robert Brady from 1937. And it's also used in these books by Paul Julian Weindling, who's an expert on Nazi Germany and Nazification, Nazi medicine and Nuremberg trials, health, race and German politics between national unification and Nazis, 1870 to 1945. So this command and control, we're seeing it now operationalized. It's bureaucratized and institutionalized through the law, and it's being operationalized everywhere, right through the National Health Service, but also in the wider culture. They are widening streets in London, Ken, and the signs on the streets, the signs of the workmen, it says, pavements being altered for social distancing. So wow. They're altering the physical infrastructure in London to accommodate social distancing. So don't tell me this is going to go in a few weeks, because contracts are placed with contractors to do the repavement, the sidewalks, so they're wider to accommodate social distancing. London Bridge, where the terrorist attack was earlier in the year, or I think last year, you might have heard of London Bridge.
Sure.
It's where the Shard is, the big new building. And that's been widened and changed, the path, the sidewalks, for social distancing. And so this is happening now right through culture. And now we're waiting now this week for Boris Johnson to announce that mask wearing is going to be mandatory in shops.
Wow.
So you're not going to be able to go shopping unless you've got a mask on. You're not able to go on the public transport now unless you wear a mask, or you're exempt. You can say you're exempt, but you know what will happen and what's happened. I've gone on public transport without a mask, and you get shouted at, you get shamed, mass shamed. And you get people looking at you, you get people photographing you and putting your photograph on Twitter. It's not happened to me yet, but I understand it's happened to a lot of people. So like Nazi Germany, you use the fear infects the population. You don't need the Gestapo to be on each street corner, because the public will do it for you. People will be made to conform by the whip that's gone right through society. The contagion fear is the whip. Yep. And that will make people, you can't do this, and why are you not wearing a mask? You're putting me at risk. You can see how it works, the mechanism that works for society.
We have a similar thing in the state of New York. Each governor of each state has assumed dictatorial powers, And here in New York State, yeah, you're not allowed to go to any shop without a mask.
Yeah.
It's extraordinary, and everything that you're describing is happening here.
Yeah.
I live in a little village, not many people. I think
Yeah.
I think we're 90 people per square mile, and I see people walking down the country road with no one around them wearing a mask.
Yeah.
There's a few things I want to double back on just to make sure everybody understands. You know, so when somebody comes, let's say they're presenting respiratory problems, it could be the flu, it could be asthma, it could be a reaction to air pollution, it could be a reaction to toxic aerosols. We have people spraying Lysol. I don't know what the product is in the UK. We have something called Lysol. Those products are highly toxic, and if you're using them in a closed space, that could create respiratory problems. It could be garden variety pneumonia. It could be emphysema. So there's dozens of syndromes, and what you're saying, and this is happening here in the United States, is no matter what you've got, they're assuming it's COVID. The second thing that you said, and we did an entire show on this, and we cannot repeat this too often, is intubation is a very invasive and very serious and frankly deadly therapy. It's a therapy of the last resort when there's no other chance, and you know that you're possibly killing the person by putting them on. At least that's how it's been explained to me.
I mean, you're absolutely right in everything you said, and to support that, what I would say is that, you know, intubation and mechanical ventilation, these are life-saving interventions for somebody who's had a heart attack and is unconscious and the heart stopped and they need to be maintained, their respiratory system needs to be maintained. People who've had heart bypass and major surgery, planned surgery. People who have a major road traffic accident and come in a real mess. This is one of the first things you do, because the risks in those situations are outweighed. The risks of the intervention are outweighed in the sense that they're life-saving, and if you don't do it, the person will die. Now, that's a different situation to somebody who comes in short of breath, their PO2 may be around 90%, 89, 90, 91, just below the normal border. They don't seem to be that short of breath, but you can't use a mask. You can't use what's called non-NIV, non-invasive ventilatory support in this setting because of the COVID fear. So they've gone towards intubation and ventilation as a first line of intervention. And, the problem with that is it's not like a heart attack victim or a road traffic accident person with a head injury, or somebody's comatose and can't maintain their own airway and can't breathe properly. You electively ventilate somebody, you've got to sedate them, you've got to make them unconscious. Then you're responsible. The machine is responsible for ventilating, keeping the heart going, and then you've got to monitor all the organ systems to maintain that person. And that's a different ball game in somebody who, comes in and, I had a situation relayed to me where this woman was in her late 40s, and she was told by the doctor she's probably got COVID and needs to be ventilated to save her life. And my colleague said to me, "What do you think?" And I said, "Well, what did she do? What did you do with her clinically?" "Well, she had to go into the other room with her mobile phone to phone her husband to tell her this information." And I immediately said, "Well, if she's able to walk from one end of the department to another with her mobile telephone, she doesn't need to be ventilated." And he said, "Absolutely, that's what I told the doctors." But, do you see what I'm saying? This
absolutely.
The protocol, the fear, the contagion fear, and the protocol drives the pathway and drives the patient down the pathway. Now, I wrote a whole book on this called the Anti-Coronavirus Toolkit. Oh. And I called it, I Americanized it, actually, Ken, because, I thought the Americans can understand this better than the British. in the sense I called it the COVID-19 freeway. You know when you get on a freeway, so I've driven a lot in the States, you come down this ramp onto the freeway and you get sucked along, don't you? All these lanes like the 405 in LA and, 6 lane, 10 lanes. I mean, they're fantastic freeways compared to the things we have here in the United Kingdom. To drive, they're very exciting, but you get sucked along. And these pathways we have for COVID are very much like that. Once the patient gets into it, they're processed through it. Yeah, what sort of consent are you being given in a situation like that? What's the medical consent? And likewise with all these tests, RT-PCR, the throat swab, antibody tests, if people knew the science of it, they read the data sheets from the manufacturers, they know these are fast-tracked through on EUA, emergency use authorization. They're not products that have come on from randomized controlled trials for years. There's no validity to them. Would anybody say, I want that? People really are, I have to say, subject to the expertise that they're given. And the British, you see, have got this conformism. Unlike the Americans, we're very loath to stand up and shout and demonstrate. We're not like the French. We don't go on the streets every week. And you've seen this in British society, this absolute conformity. Lots of people I know have been surprised about how the British have just buckled under and accepted all this bad science from Imperial College, the stuff that Birx and Fauci have been pushing out in the States, and have just buckled under, and I'm wondering, will there come a level with this? Will there be a critical point at which people will wake up and say, this is too much? Now, maybe I've gone on a little bit too much. Has that answered your question?
No, it's excellent. Do me a favor and give me your reaction to this, an analogy.
Yeah.
Somebody comes into the ER with chest pain.
Yeah.
You don't immediately take out a saw and open up their chest.
No, you don't.
And yet that seems to be what they're doing with this so-called
absolutely.
COVID.
Yeah.
Is it a fair analogy?
Oh, a very good analogy. I mean, chest pain, look, the sort of algorithm to diagnose chest pain is guided by the principles of doing several things. The first thing is it cardiac in origin? Is the chest pain classically cardiac? Does the pain radiate down the left arm? Does it go up into the neck or the jaw? Where is the pain? Does it move? Is it static? What does it feel like on a scale of 1 to 10? Is it mild? Is it severe? Is it crushing? Is the person breathless at the same time? What's the color of their skin like? Are they blue? Are they cyanosed? Are they white? Is the circulation affected? All these things a nurse practitioner or a physician would do automatically as they're interviewing somebody, yeah? And how do you do that, Ken, over the telephone? How do you do that when you've got somebody who's like two meters distant from you and you can't put your hands on them? Yeah? It's complex. You can do it to some extent, but you're going to have a lot of false positives doing that. And you also need to do lab workup on somebody. You need to do their, you have it, you can just watch any episode of the American TV series. The hospital ones are very good, like ER. You do full blood count, you do urine electrolytes, you do cardiac enzymes, you do a whole workup, and you can do some of it standing there on the machine, in an ER department these days, and you can get results very quickly. Now, why is that not being done? Somebody presents with a sore throat, pyrexia, temperature, and a cough. Why isn't that similar workup being done with them? Why are they automatically being processed as COVID, presumed COVID, until the PCR test comes back? It's quite bizarre, really. And the reason for that, I would say, I'd answer my own question. Mm-hmm. I hope you don't mind me doing that.
Not at all.
Would be to say, because the propaganda, the science is propaganda, it's been put out since day one by WHO and is being bought up by all the local national health authorities, and it's been pushed down the line and thrown down our throats as clinicians. And that's what you saw with these videos very clearly in America, the Bakersfield doctors, the Kyle doctor in New York, the nurses, those wonderful nurses, can't remember their names, but they're really, tweeted all those out many times. They were able to confound this propaganda by their own clinical experience and immediately problematized it and said, this is incorrect. These are, and look what happened to some of these people suffered as a result. We have one we have one consultant in this country who apparently has said COVID's a hoax, and he's been suspended by the General Medical Council. His registration's been suspended.
We have a state legislator in Minnesota who is also a general practitioner of 35 years experience. And he questioned, he didn't call anything a hoax. He just questioned a few things, and his license is now up for review in retaliation.
And Ken, can I just divulge something personal there?
Please,
because I was a lecturer for a long time, and then I retired from the university 4 years ago when I was 61. And I thought, I worked as a consultant doing bits of research and things. Then a couple of years ago, I decided, at the end of my nursing career, don't laugh, but I wanted to do something clinical hands-on again before I finished. Mm-hmm. Which is often because I've been in the university for so long, been doing research, teaching, publishing. Universities are not very good in this country of allowing nurse academics to be clinicians. So I thought I'd go and work as a nurse practitioner. So I got a job, a very nice job with the Metropolitan Police, working in custody with people who are arrested. So it's like an ER, you're the only nurse. And there's no doctors on site. So you're diagnosing, you're doing the differential diagnosis every day, every minute. You're looking at the risk and assessing whether somebody should go to hospital, etc. And I came out of that job, just coming up to 65 last December, just before the COVID stuff broke. Mm. And when the COVID stuff started getting going in February, I was contacted by a few colleagues in one of the well-known London hospitals. We need somebody like you. We need a PhD nurse to come in. We're doing all these tests. We've got to, test people. And I got offered this very good job. And what they wanted me to do, Ken, was to force people having tests. They wanted me to coerce people having tests. And they didn't use those words. But when I said, where the consents for this, people obviously need to consent. And they said, of course they'll consent. Just tell them it's an emergency and they've got to have it. And I said, well, I'm not so sure about that because I've taught medical ethics 20 years on and on. Call it different things in different curricula, but I've taught around those subjects for a long time. And I said, well, what happens if people say no, they don't want the throat swab, they don't want the antibody test? They said to me at the interview, it's your job to make them agree. And I said, well, I don't agree with that. So I got a really bad feeling about the way the NHS was going. And I came out of that interview and I actually turned it down. And, I thought very clearly, and from my colleagues then contacting me over the next few weeks in March, I thought I've reached a point here where I couldn't work in this, So I actually took myself... because what I wanted to do, Ken, it made me want to fight it, Mm-hmm. Mm-hmm. I thought I cannot fight this while I'm on the nursing register because I'll be reported.
Sure.
That article that you just mentioned, the COVID Nazification of the National Health Service, I know several people that I know in the nursing profession in this country have already contacted the nurse regulator about me.
Sure.
Because they wanted to file a complaint saying it was unprofessional, that I was talking the truth. But because I'm no longer on the register, I'm immune to a complaint about my clinical practice. So really what happened in February, March propelled me into this situation of where I can use my background and clinical experience to try and alert people and try and encourage some sort of criticality about this. Yeah.
Yep.
I hesitate to use the word fight, and I'm not sure it is. It's more of an educational criticality about what they're doing and what's actually happening in society. And that's my 30 years as an educator. Well, look, every nurse and doctor is an educator. Even, they don't have to be in a university. They're teaching people all the time. They're teaching their colleagues. They're teaching the public.
Sure.
Look at those Bakersfield doctors, the Kyle doctor in New York, those nurses. You just I could sense the validity in what they were saying by listening to them. The internal validity of what they were saying to me as a trained healthcare professional spoke within the first few minutes of their videos. Yeah.
Yes.
So I automatically knew these are credible stories. Yeah.
Yes. Yeah.
And it matched everything I've heard here in London. And, I'm constantly now, every week, I'm getting contacted by generally retired doctors who agree with me 100%. They've read my papers. They've seen what's happened to Dr. Adil, the doctor who's been suspended. And there are other cases coming up as well. And so there is a groundswell of opinion emerging now that is critical of what's happening. And I'm hoping that this will gain momentum like a snowball. And it will, because we need a bit of American spirit here. America was founded, it's got a written constitution, it was founded, outside Europe. It was people that fled or were thrown out or didn't agree with. So American psyche has got and the United States, by that I mean United States, not necessarily Canada, but the United States has got a different psyche. It's always one of contest, trial, and public discussion of things. There's a transparency about your society. You may not appreciate it, but I appreciate it. We appreciate it over here in the United Kingdom because we've tried to emulate it in many ways, but we're still a very conformist society, I think, in many respects. And I'm sure that America is in its own way as well. But what I've seen in terms of doctors making videos and nurses making videos, I haven't seen that here in this country. I've been able to do one interview with a nurse off camera. She's very good. It's 3.5 minutes, and it doesn't go into all these issues. It just mentions a couple of contradictory issues. And, it's very difficult to get doctors and nurses here to be, to stand up and say, look, and I think, the other thing that's very important to mention here, Ken, if I can, is that what's happened since Christmas and been happening for a long time, maybe the last 20 years, has that healthcare professionals' allegiances have been shifted towards the state and the government, away from the patient that they're dealing with. And that's another similarity to Nazi Germany, where the Volk, the nation became the patient. So people have to sacrifice for the nation. And we've seen that in the last few months with the National Health Service. Stay at home. Don't bother the National Health Service. Don't even call us because we're protecting the National Health Service. Well, what about the individual? And our money is collected in this country from our taxation. We're forced to pay for the National Health Service. It's not like in America where you can decide to have this insurance or that insurance. You can go to this HMO or the other one if you can afford it. Mm-hmm. In this country, your money for the National Health Service is deducted automatically from your salary at point of earning. You don't even see it. The government takes the tax of the National Health Service, and now it tells you, stay at home. We don't want to see you if you've got symptoms. Just hang on. And of course, Ken, that's what happened since Christmas. People with COPD, asthma, diabetes, type 1, type 2, people having strokes, people having heart attacks. These all happened in their homes because they were told to stay at home. People with cancer were left. Yeah, everybody's got an anecdote about that. I mean, I've got a friend, she's 62, diagnosed with lung cancer in February. end of February, she was told she's got lung cancer. And the consultant said, at the moment, with the COVID thing coming up, we can't treat you. We'll send you home and we'll contact you. April, she was contacted. So February, March, April, it's probably about 2 months really, with lung cancer.
Yeah.
I mean, that's quite a significant anecdote, isn't it?
Sure.
Now, that anecdote, I wrote that anecdote in a polite email to my Member of Parliament, who is a very famous man called Sir Keir Starmer, who happens to be the leader of the Labour Party, taken over from Jeremy Corbyn. And I got no answer to that email. I suppose I did write it in a heartstring way, saying that this person was left, in the lurch. But, we have been vacated really by our elected representatives, and that's not unusual. It's happened in the States.
Sure. We have the same thing here, pregnant women, people needing physical therapy, people needing dental services.
Yes, that's right.
Basically every normal medical procedure has been in suspension.
Yes,
for months.
Exactly. We had cases because the General Dental Council in this country in March suspended all dentistry completely. And the only way you could see a dental surgeon was through the 111 telephone service, and you're put into the National Health Service through an A&E department, and it took weeks. There were cases of people in the United Kingdom in the 21st century taking their own teeth out.
Wow.
Because they had abscesses and they weren't being treated and they couldn't get into the service. So whichever way you look at it, ophthalmology, eye medicine, etc., every specialty is the same. And because of the contagion fear is dictating the whole strata of the National Health Service and what they're going to give you when they feel like they're going to give you anything. And, this is incredible to see this,
Talking about the contagion fear, it might be a good point to do a review of the specific parallels between what's going on and Nazi medicine, because I've done somewhat of a dive into the information. There's an excellent book by Robert J. Lifton called The Nazi Doctors. Anyway, the whole contagion fear in Nazi Germany was based on garbage science. It was ludicrous.
Yeah.
And we're finding the same thing with COVID, the idea that, you have to be 6 feet or 2 meters away from somebody that just simply breathing. An asymptomatic person could walk down the street and leave a stream of deadly virus that hangs in the air. I mean, it's just insanity.
Robert Lifton's book, it's a very seminal study in the 1980s. And he was absolutely brilliant in the way that he was able to capture first-hand accounts before people died. And what he found was, that many of these were ordinary doctors. The contagion fear infected the whole of society. And so people were being propagandized around racial hygiene. And it was these concepts that impacted and skewed medical practice in a very pernicious way. And viral hygiene is the parallel today. I think the issue with Robert's book is that he describes it in great depth, and people reading that should be able to make the links to what's happening today. You see, in the 1920s and 30s, eugenics was the key thing. It was everywhere in America, hugely. And the Nazis borrowed a lot of the American theory. But what happened was the Nazification of racial hygiene is like the COVIDication of virus hygiene now. That they're saying to us genetic sequencing of something equals isolation of the virus. A genetic sequence is equivalent to a morphology.
Mm-hmm.
You know? And this is a sort of a modern day version of Nazification of virology. And what will happen, I don't know where this is going to end up. But, you know, you've got these incredible statements now about, you've got incredible statements being made by scientists around the transmission concerns of this so-called agent, which has never been purified. Right. It's never been isolated in a traditional virological sense. That's something that, you know, I'll be criticized for saying, because, you know, now the notion is you can't criticize science as a citizen. You've got to be the scientist to say something. You know, I don't know what you feel about that, but, you know, do citizens not have a right to criticize science?
Well, also there's basic facts. The technical term is purified, but the layman term would be isolated. Nobody has ever isolated this virus adequately. You know, and the only pictures I've seen of it, besides the science fiction 3D graphics that the news people have, is a very sketchy, fuzzy, black and white photo that could be almost anything. So
exactly. And you know, when this all broke in February, started to break, I worked up a set of questions that I wanted to ask the public health authorities. And I managed to identify the professor at Imperial College. Her name is Maria Zambon, who is in charge of the reference laboratories for COVID testing, SARS-CoV-2 testing and COVID testing. So the reference laboratories, I'm sure you know, are the ones that do the confirmatory testing. So they're in charge of all the methodology that's used across the health service. And I asked her, why do not isolate the virus, purify in relation to developing a gold standard for the tests? And the sentence was just a sentence that said, WHO advised us not to isolate. So this is very interesting, Ken, because this is an example of where our national science is now being superseded by a supranational organization called the WHO.
Right.
Yeah. So in the 1980s, this country, the Public Health Service in the United Kingdom, developed a different type of methodology for testing for HIV compared to the United States. We threw out the Western blot and we used different ELISA tests instead of the Western blot. And, you know, the clinicians in America couldn't understand it. They'd always give a diagnosis to a patient based on the Western blot. In this country, we didn't do that because we thought the tests were too operator dependent. So public health in this country, under quite a visionary leader called Philip Mortimer, developed what was called an alternative algorithm of different sensitive and specific ELISAs. And that was written up and it was researched and it's published and it's sort of all over the world now. But now with COVID and SARS-CoV-2, we're under the you know, auspices of the WHO for the science. So, you know, a lot of people are saying, well, we never really had Brexit. You know, we voted to come out of a federal organization called the EU, and for the reasons of autonomy and sovereignty. But within the science now of COVID and SARS-CoV-2 in this country, you've got the domination of WHO. And I know that a lot is being talked about this in the United States. I know that Trump's already come out of WHO, isn't that right?
Yes, it's astonishing. He's removing the United States from the WHO.
Yeah, and I think, you know, he's absolutely right, Ken. I mean, he's absolutely right because, you know, they have a vested interest, WHO, let's face it. They've said so many contradictory things since Christmas. They said it wasn't infectious. They said don't shut borders, it'd be racist. They said the opposite. They've said the opposite now. We've got to do this, we've got to wear masks, we've got to, all this contagion fear. Totally discredited organizations should not be guiding our laboratory testing in this country. So I put all that stuff on my website, the Public Health England here, Professor Zambon answered all the questions, and people can have a look at it. You know, some of it's quite technical, and that's the problem with all this, Ken. It's arcane and technical, you know, and the experts rely on that for saying, don't bother your little heads over this, public, you know. We know all about this. We've isolated the virus. We've got accurate tests. They might be a bit dodgy here or there, but generally they're okay. Just get on and, you know, walk down the sidewalk in a certain way, go into the supermarket in a certain way, do what we tell you, wear masks, just be compliant, and everything will be fine. And it won't be, because now they're saying to us, Ken, this week in the United Kingdom, the antibodies are not going to last.
Right.
So,
they're saying that here too. They're trying that here too.
Preparing the public for vaccination. Vaccination because herd immunity won't work. That's what they're saying. And that, you know, when you look at the papers that are pushing this, and you look at who's funding it, you know where it leads, don't you? You know, the usual suspects.
Yeah.
Wellcome, GSK. I hate to say this, Bill and Melinda Gates. You know,
Right.
I mean, those guys must be the most vilified people on the planet.
You know what's interesting is in 2010, Bill and Melinda Gates declared the decade of the vaccination. That was their,
Exactly.
you know,
Yeah.
and on their board was Fauci, and the then head of the WHO, Margaret Chan,
Yeah.
who only just recently is gone from that position. Now she works directly for the Communist Chinese, but she spent 10 years as head of the World Health Organization.
Yeah.
And without putting too fine a point on it, she was an incompetent, an absolute bumbling incompetent, and yet wields tremendous power.
Yeah.
So I've seen the numbers on the hundreds of millions of dollars that Bill Gates, who wants desperately to enter the vaccine industry, has given to the World Health Organization, to the CDC, to the NIH, to the Oxford people.
Yeah.
It's extraordinary. It is one other area I about the Nazification, so that people realize that we're not using that word lightly.
No.
This is what I'm going to talk about now came from a book called Doctors from Hell by a woman named Vivian Spitz.
Yes,
and
that's right.
There was a most illuminating introduction to that book, a foreword by an MD named Frederick Abrams.
That's right. Yeah.
In addition to the garbage science being used to make people fear contagion, the other thing that's very similar is the fact that they removed, the Nazis obviously removed a lot of Jewish doctors from academic posts, from managing hospitals, and replaced the good doctors with Nazi party members who also happen to be MDs. And the point that Abrams made is that the medical profession in Germany during the Nazi time was the most had a higher percentage of active Nazi party members than any other profession.
That's right. Yeah.
This is a very important thing for people to understand. The other thing, this whole issue of consent, which is so informed consent, which is so important, and we have testimony. We also have live video of doctors absolutely lying to patients to get them to be intubated, saying, well, we'll be able to get you out of here faster if you consent to being intubated. Well, that's not accurate. Once you put somebody on a vent, now it's become, as you pointed out, a very heavy management situation, and it's very difficult to get somebody off a vent safely. So there's nothing quick or easy about it. So the doctors are not, people are agreeing to serious invasive medical procedures without proper consent. But there's one last piece, and I'm sure you're aware of this. The linchpin of keeping the work at slave camps and the which were also doubled as extermination camps, the absolute linchpin of those systems was the medical personnel. And the linchpin of their activities was the falsification of death certificates.
Yes, exactly.
And we're seeing, I don't know about in the UK, but we're absolutely seeing that in the United States. A guy comes in with, stage 4 cancer, diabetes, stroke, and he dies, and they declare it a death from COVID.
Yes, well, exactly. And I can talk a bit about that because we had a similar situation. The Coronavirus Act that was passed in the UK removes the need for a coroner's jury.
Wow.
So it actually states that explicitly.
Wow.
And therefore, the coroner can decide cause of death. And you've had situations where coroners have decided this is a COVID case when the clinical evidence said opposite. You've got this, as we discussed earlier, you've got this skewing of the differential diagnosis. So you've got these presumptive COVID diagnoses being made, right? That carries forward through the whole system. So when somebody dies, they're presumed COVID already. Right. So the coroner will just rubber stamp that, and there won't be a need for an inquiry. And I think you've had more transparency over that in the United States because of your system. As I've said, people speak out. Here, you've heard this happening behind closed doors. You've heard of this by and by second hand or third hand. People haven't written about it. That article that I wrote, people found it horrific that I even thought about such things, really? Let alone had evidence of it. This is really very, very powerful in this country. There was a case that hit the media, spiked online. You probably read their website. There was a 19-year-old death, COVID death. The media went wild over this because, it shows that anybody can get it. She was 19, she died, photo of her, she looked like a model, The reality was this woman had a congenital heart problem, had died, the end stage of a long line of illness.
Wow.
And I think the doctors looking after her put it down to ventricular failure. Mm-hmm. The coroner overturned it because the note said she had a cough when she was dying.
Unbelievable.
So a somebody with a complex cardiac condition that died after a long illness was rebranded as COVID, and really it's quite hard, I think, for the public in this country to get their hands on that sort of data because, as I said, we have a Freedom of Information Act, a Parliament and stuff, but we're not very good in this country, unlike the Americans, of getting our hands on the experts and calling them to account. We tend to put our experts on a pedestal and do what they say to a greater degree than the Americans do. And but also, this way of, I would say, covering up the deaths.
Yeah.
Covering up.
This is exactly what happened in the camps.
Yeah.
People who, this is very important for people to understand. So the camps were primarily slave labor.
Yeah.
And then when somebody was no longer fit for labor, then they would use them as medical experiments. And then here's the key thing, and people don't realize that the Nazis were very law abiding. They had, orders and they had regulations and they followed them, and it wasn't legal to do the things they were doing, and they knew it. So what they did was, when they murdered somebody through medical experimentation, they just changed the death certificate and attributed it to some natural cause. So this monkeying with the integrity of the death certificate process is not a joke. It's not trivial. It's not a small thing.
And you see, this situation of the whole concept of informed consent came out of Nuremberg. Yes. It was a result of Nazi Germany and Nazi medicine in the 1930s and 40s. And really, this came about quite relatively recently. Medical practice, and by that I mean healthcare practice, is always double-edged, right? It's always double-edged. And I used to teach this to medical students. Whoever wrote the Hippocratic Oath knew this, because they warn in the Hippocratic Oath about the iatrogenic effect, you know, that medicine can be killing, it can be curing. It's double-edged. It's two sides of the coin.
Sure.
And the thing is, the Nazis were very clever at covering this up covertly. They had all sorts of experimental programs operating right across the country, involving the camps and outside of the camps. You know, they killed people with learning disabilities. They killed people who are mentally ill with schizophrenia and other mental diagnoses. And, you know, that was euthanasia. And they were all done covertly. When it hit, some of it hit the public domain, there were complaints and they rolled back. What you've got in this country now is undoubtedly there's no informed consent in the National Health Service now. How can there be? Because they must be trialing all these antivirals on people and other drugs. It must be a heyday for what's called unchecked medicine, you know, unbridled medicine. You know, people will be, you look at the medical journals, go on any website today, and there's fast track for your COVID paper.
Yes, yes.
Yeah, fast track. Do you want your COVID paper published quickly? Click on this, you know, icon. And so you can see it's a feeding frenzy, you know, like HIV was.
We have a program, our vaccination program is called Warp Speed. And it's being, that's the code name, and it's being co-managed by a U.S. Army general.
Yeah.
And there's a man here, I'm forgetting his name, but he wears a bow tie and he's always on the news media promoting whatever vaccine they come up with. He thinks it's the greatest thing. Even he is horrified. And he was on the news the other day, and I'm sure he'll never be allowed to speak about it again. He's horrified at the speed with which the coronavirus vaccine is being pushed, because he points out that we've been trying to develop vaccines for coronaviruses. It's not a new, I mean, this variety may be a new variety, but the class of virus is not new at all. It's the basis of the common cold. And we've been trying to develop vaccines for coronaviruses forever, and it's always ended in disaster because it just it doesn't seem feasible. But anyway, so we have a U.S. Army general managing a program called Warp Speed. To get this vaccine. Oh, by the way, I don't know if this is well known. Do you know this book?
Yes. Well, who's it by? I've forgotten the name.
Well, it's extraordinary. It's a woman named Christine Grady.
Yes.
And it's all a justification. You know, it's vaccines are the greatest thing ever. And but let me. There's a punchline here. I want you to hear this because very few people realize this. It's a rationale for relaxing and she's the wife of Tony Fauci.
Oh right. Oh yes, I've seen her. Yes, great.
And she's the made head of medical ethics and human experimentation standards for our National Institutes of Health. Can you imagine? And that's not even known to the public. So anyway, I just wanted to share that.
Well, you know, that's a very interesting title on that book about, you know, the AIDS vaccine. Let me just have a look at it again. The search for an AIDS vaccine. Right. Now, go back to 1994, and a very famous virologist called Bernard Fields, he wrote all the textbooks. He wrote a very famous paper called AIDS, Turn to Basic Science, I think the title was. And what he was saying there was very coded. He was saying, if you take the polio situation, it was the isolation of the polio virus that allowed us to develop a vaccine. Then in the next sentence, he said, HIV has been identified. Blah, blah, blah. You get the message?
Yeah.
Identified, not isolated.
Right, right.
He didn't use that word.
Right.
And, you know, I'm very interested in the fact that he wrote that paper shortly before he died. And he was saying to the virologists, you know, really, you know, we've got PCR, we've got all this high-tech geneticization, but unless you get the basics right, you're not going to get a vaccine.
Right.
And he was sort of saying to them, you haven't got the basics right, you know? And this is why it's very easy for them to turn around, these genetic virologists, and laugh at the Perth group. They like to laugh at the Peter Duesbergs. They like to laugh at anybody that pokes their finger at the Achilles heel of AIDS science, you know, which is the fact that all these years later, there's no vaccine. When I went to work in HIV in 1987, Professor Semple at the Middlesex Hospital unit that Princess Diana opened went on the front of the Daily Express saying, we'll have a vaccine in 2 years.
Right.
And now it's 2020, and that was 1987. Oh God, you know, I'm in my 60s, I was in my 30s then. No vaccine. So let's just remember that, you know, after all the money pumped into it, COVID is going to be the same thing, but on a bigger scale, a bigger waste of money, a bigger hoax, destroying culture, destroying medical practice, actually. You know, I didn't like using that word Nazification, but the command and control throughout the whole of the medical and healthcare practice in this country is what's happened. It's like somebody's got the reins, you know, and they're pulling the horses together and they're corralling them in one direction only, irrespective of the truth. And, you know, I think we're heading for, unless something happens, Ken, and there's a sort of a grand wake up, you know, then we're heading for, well, what are we heading for? We're heading for a viral dystopia, a viral hygiene dystopia. And, you know, the book that I read when this all started was Isaac Asimov's The Naked Sun, published in 1956, which told of a world, another world, you know, far across the universe, but inhabited by humans, where people lived virtual lives on screens. They were frightened of infections that they never met. And when they did, they had masks, they had nasal filters, and they wore gloves.
My goodness. What's the name of that book?
The Naked Sun. The Naked Sun.
My goodness.
By Isaac Asimov, 1956.
Wow.
And do you know what the story's about in that book? The story's about a murder that happens on that planet. A murder where somebody gets killed in that society. Society run by robots. People live on big estates, you know, half the size of one of your like half the size of New York State is one person's estate. It's all run by robots. But in that culture, there was a murder. But they don't have a concept of forensics. Yeah? They don't have a concept of being able to work out motivation because they've all been genetically selected. They've all been programmed as a sort of genetic population, a genetically selected population. And so they're conformists. They can't think outside of the box. They fly in, they rocket in an Earthman, you know, private dick to sort it out. And it's a fascinating story. But when I read it, I thought, this guy Asimov's interesting, like Philip K. Dick.
Yeah.
These people had an idea of where society was headed.
Sure.
And they were living in the 40s and 50s, but they could see it coming. They could see the dystopic elements already, you know. Oh, George Orwell was the same here in this country, you know. It's Orwellian what we're living through now. But, you know, last week, Ken, our Minister of Health in the United Kingdom, do you know what he said? He said it's mandatory for people to wear masks on public transport in the United Kingdom, and there's a £100 fine if they are not exempt. But for the people that are exempt, maybe we should give them badges that they can wear. So, Ken, my tweet that day was to the world, badges for exemptions. How about a pink triangle or yellow star badge?
Sure.
You get the message.
Yeah, absolutely. Which is for people that don't know the historical reference, that's how the Germans coded people by making them wear stars that identified their contagion.
Yes, they're contagion. And that when I went to Oxford at the weekend to a public, I wouldn't call it a demonstration. It was a seminar that we had in the town in Oxford, the city of Oxford, and we discussed contradictions to the science with members of the public. It was very civilized. We had a couple of very angry epidemiologists from the university. But, generally it was a very, very, civilized discussion. It wasn't any demonstration in any way. And I didn't wear a mask on the train. People were looking at me as though I was a risk.
Yeah.
Nobody said anything, because although people do now in London, apparently there's been instances in the last few weeks in London where buses have been stopped by members of the public on the bus because people got on without masks and people wanted them removed. So the police were called. But you don't have to really read Isaac Asimov. You don't really have to know much about Nazi Germany. But I actually do think it helps to have a bit of a background here, because the history and the fiction, it's already been done this. It's been done before.
Yes.
But we haven't learned from it.
Yes.
How come people are being pushed drugs and interventions in hospitals and ER departments in our countries without informed consent when we had the Nuremberg trials, Yeah. I mean, anybody being asked to have a test should say, can I see the data sheet from the manufacturer for that test? I'd like to know what they say about the test, And if you read it, you wouldn't have it. You wouldn't touch it, as the British say, with a barge pole. I don't know if you have a similar.
we say with a 10-foot pole, which is probably how long a barge. Which is probably how long a barge pole is.
You see, we're different. We're similar language, but we're completely different cultures, Ken, aren't we? I mean,
absolutely.
It is good that we can communicate.
And maybe we should wrap it up with this issue, because we could talk forever on this. There's so much to discuss. Mm-hmm. The issue of the testing. David Crow related a case where a man was tested, found positive. He was put in the hospital. Then they found him negative. Then they found him positive again, brought him back to the hospital, forced, by the way. And he was just going in this endless loop, all based on a unreliable test. So I think it's fair to say, we have I'm in a county, and the county executive, who has no background in science or medicine, is telling everybody we should all get tested, which was the same nonsense during the AIDS era, that everybody should get tested for AIDS. The tests were unreliable. And the frightening thing is, the test can be used, this unreliable result can be used against you. It could be used in the AIDS era. It was used to force pregnant women to take AZT and to feed AZT to their newborn children. AZT, by the way, for people that don't know it, is a serious carcinogen and mutagen, killed hundreds of thousands of people. And there's something similar in coming down the road here. I was just talking to a physician from Canada. He was found to be positive, and he was forced to quarantine for 14 days. He couldn't, and he's a contract worker. He doesn't earn any money unless he's practicing, all based on nonsense. So. Am I expressing the case accurately?
Absolutely, and I'd encourage everybody to read David Crow's work on antibody testing and the RT-PCR tests. And we have this in this country where healthcare providers are forcibly coercing their employees to test, and one of them in London has made their employees test every weekend. Every week, they've got to line up at a hospital with a card, and they've got to have it stamped before they can go back into work the following day. And their manager has got to read that stamp and sign a form. So this is like prison. It's like Nazi Germany. It's like Stalin's Russia. It's like a communist system. And there's no informed consent there, because the contracts have been changed. I've read their contracts. They're told refusal will be disciplinary and dismissal. So that is not informed consent. That is coercion. That is communism. That is Nazism, whatever you want to call it. But it is not what we're used to, And
it's not, and it's not based on any medicine that we've ever seen in the history of humanity. No, except maybe Nazi medicine or Maoist medicine, Soviet medicine.
Lysenko science, it's a sort of bastardization of the science for ideological purposes, for a belief system. They cream off the bits of the science they want you to believe that fits their agenda, you know. And I don't like using they, but it's the authorities, it's the people coordinating this that's the problem. There we go.
So Kevin, for people that want to follow your work, and I strongly encourage everybody to do this, Kevin has a website. It's Kevin P. Corbett, and I'll spell that in a second. Kevin P. as in Peter, Corbett.com. And Corbett is spelled Corbett. So it's Kevin P. Corbett.com. And what will they find there, Kevin?
Well, that website is an art website, because I'm also a visual artist. But if they go on that website, there is a button to press called Corona Hysteria.
Okay.
So it's www.kevinpcorbett.com/Corona Hysteria. And Corona Hysteria, I think the term is fairly self-explanatory, don't you?
Yes.
You know, we're living in a Corona Hysteria era. And all my papers and links to other websites, including David Crow's, are on that button. Yeah.
Great. And David, of course, is an excellent source for all this. That's Crowe, Crowe, and we've posted a lot of his material on the site as well. Well, Kevin, thank you so much for sharing your experiences. We've been talking with Kevin Corbett, started out as a hands-on nurse, became an educator, professor, PhD, a trainer.
I was never a professor.
Oh, sorry.
I was an academic. Yes, I mean, you call academics over there professors, but I was a lecturer.
A lecturer, okay.
Yeah.
But an academic.
I was never good enough to be a professor, Ken. So.
Oh, okay. Yeah. But an educator of nurses, including somebody that has spent a lot of time studying the history of medical practice and the ethics of medical practice. Which, by the way, is part of the curriculum for all doctors and nurses.
Yes.
And we had a medicine pre-COVID. It had a set of ethics. It had a set of guiding principles. And as Kevin's pointed out, in the UK and in the US as well, these long established working principles have been thrown out and are being replaced by what I think Kevin fairly calls the COVID Nazification of medicine, and it's happening in the United States too. So, Kevin, thank you very much.
You're welcome.
And everybody, again, it's Kevin P. Corbett with 2Ts.com/Corona Hysteria. Thank you, Kevin.
Thank you very much, Ken.